When it comes to other hacks we can do,
Mhm.
we got the nose strips,
Yep.
the nose inserts,
Yep.
mouth taping.
Yep.
Talk about these and any value there.
I think mouth taping is one of the stupidest ideas I've ever heard in my life. And I talk about it to people all the time. And here's why. Mouth taping, if you haven't been tested for sleep apnea, it masks the signs and symptoms of sleep apnea. And your sleep apnea just gets worse and worse and worse. And so you really want to cause yourself a problem is keep taping your mouth shut when you haven't been tested for sleep apnea, and you're gonna wake up one day with a much bigger problem on your hands than you normally would have. If you've been tested for sleep apnea and you don't have sleep apnea, but you sleep with your mouth open, there's a reason. It's called congestion. Okay, 90% of people sleep with their mouth closed as long as their nose is open. So being able to irrigate your nasal cavity with saline wash, right? A neti pot, that there's this thing called Navage that you can buy that pushes, salt water up through your sinuses and out and gets all the gunk out, is one of the best things you can possibly do. Or using a nasal steroid spray like a Flonase or something like that before bed can be helpful as well. But if you fix the congestion, you usually don't need the mouth tape. So again, I'm not a fan of mouth tape. Also, there's a company called Hostage Mouth Tape. I think that's disgusting, right? Like, there are real hostages out there. Like, what are these people doing? So I'm not a fan of mouth tape in almost any form. I do have some patients who are on CPAP and use mouth tape with the CPAP machine. Like, if they have a nasal only, I don't think I have a problem with that. I think that makes sense. Now, the nasal strips that go on the outside, if they work for you, I don't have any problem with them. For me, I have kind of oily skin and they have a tendency to migrate. So I've woken up where it's like across my eyeball and things like that. So that doesn't work. I personally like the nasal inserts. The one I use the most is called Mute, M-U-T-E, like hit the mute button. It's $15 at Walgreens. I have no association with them. But as an example, if I drink alcohol, my wife will be like, hey, go throw your nose thingy in because you snore worse when you drink alcohol than when you don't. So I have no problems with those internal nasal dilators. The external ones just don't work as well for me.
Any other devices we haven't covered you see people using, whether they're valid or not?
One of the things that I think is kind of interesting that I've seen a lot of people start to do are these vagal nerve stimulators, right? So there's things that you can put on the back of your neck, there's things that you can place in your chest, and these they send out a particular frequency that helps turn on the parasympathetic nervous system. So I want to be clear, the data is getting better and better and better with these vagal nerve stimulators. And I'm really starting to find that a lot of my patients who have middle of the night anxiety, or who are generally anxious people, they can definitely benefit from some of these vagal nerve stimulators. But this is not going to cure every single thing that ails you. But if you have anxiety and you follow the breathing techniques with them, and you work with these types of things, I think they can be valuable. I personally use one called Apollo. I found it to be work very well. There's different ones out there that I think people can use and enjoy. I'm trying to think if there's anything. Oh, sleep masks. We talked a little bit about it, but there's different sleep mask technology out there. I would say, wander around. What you want to avoid is the flimsy, silky ones, because they slide all over your face and they don't really have a tendency to work very well. But I feel like we've kind of covered just about everything I can think about.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
What do I do when I wake up at 3 o'clock in the morning and I can't go back to bed? By the way, is kind of the number one problem that people ask me about. This is exactly the protocol that I use with my patients. So every human on earth, dude.